Hi, I'm Jasmine. I'm a nursing student from JCTC. I made this video for my nursing friends. We all learn in different ways, and um, I just hope you guys like this video. So this video is going to talk about postpartum, what postpartum consists of, and this video in particular is going to go over involution, um, like the first hour of postpartum. Why is it important? And we're also going to go over things that enhance involution and the fundo positions. Okay, so okay, so postpartum. When the mom gives birth to the baby, that hour after is called the golden hour. Okay, that hour is very important because during that hour, only primary family is allowed. Siblings are not considered visitors, neither is the dad. Okay. So we're gonna make sure that they have that opportunity to bond with that baby. Um, because when family members are coming in, they're gonna lose that opportunity. And also it's very important during the first when the baby's first born for the mom to get that first feed in, and maybe breastfeeding so she gets more comfortable. Because she may be a new mom, she may be scared. Dad may be new dad. Siblings might have a new sibling that they never met before. And this is a good time for the siblings to like touch the baby. And what we're gonna do too, I'm gonna go over in the future, is that we're gonna have to bond. We're gonna assess the mom bonding with the baby, okay? And different things can affect bonding, which we'll go over in a different video. Another thing that I'm gonna discuss with you guys is couplet care. Couplet care is one RN per family. You want to make sure that mom feels safe, and it's easier for the mom. Um, and when I say easier, you don't want a bunch of nurses, different types of nurses, asking the same questions over and over again. You want to build a good rapport and a good trust with the mom and the family too. Um, this term is called, forgive me if I'm not saying it right, puerperium. This is the first 6 weeks postpartum. Okay, so during this first 6 weeks postpartum, this is a time where everything's going to go back to normal, or what mom considers back to normal. And that sense of normalcy comes with culture and tradition. An American culture is very different from an Asian culture, uh, or any type of Eastern European culture. It's very different. Everyone has different cultures, everyone has different traditions. And during this time, no, excuse me, we need to implement their culture in their plan of care. Okay. Um, Physical adaptations. So, usually, with a healthy pregnant woman, uh, the uterus naturally descends back into the pelvic area. Okay, becomes a pelvic organ again. With pregnancy, it is a abdominal organ. Okay, and if her pregnancy went well, the uterus will involute back to where it belongs. However, there are things that can restrict the uterus from going back to where where it's supposed to was the back to being a pelvic organ. Okay. One of those things that will happen that restrict that is medication. Medications such as Pitocin. Now, why Pitocin? Pitocin is because it makes it harder. Okay. Pitocin is artificial medication that's used to induce labor. Okay. That puts stress on the uterus. Another thing that restricts involution is anesthesia. Why? Sensation. Sensation loss. it's going to make it really slow. Okay, it's not going to go down as fast as you want it to. Other things that restrict involution have to do with distension over the uterus. Okay, so so overdistension of the uterus. Okay, the best way I can describe the uterus is it is literally like a rubber band. If you use a rubber band too much or you put too much stress on it, it will not regain the same shape as before. Same goes with the uterus. So, things that can cause overdistension is grand multiparity, which we refer to as having a lot of children. Okay. Another thing that can overdistend the uterus is if the labor is really long. Okay. A prolonged labor can cause so much stress on the uterus, it will have a hard time getting back to where it's supposed to go. Okay? Because a prolonged labor causes a difficult birth, which then makes it harder for the uterus to go back down. Okay? Break it down. And difficult. Another thing that can cause overdistension of the uterus is if you have twins. Beyonce just had twins. I'm really surprised her uterus went down like that. She probably had help. But twins do cause overdistension of the uterus. Uh, Now, as the uterus, let's say you don't have those problems, okay? This is your first kid. You didn't have a difficult labor, but you aren't going to the bathroom. So, your bladder capacity can affect involution. Other things that can affect involution are two things that sort of coincide with each other. Let me get into a little later, but I'm just going to mention them now. Your placenta. Okay. In a healthy woman, in a mom who had a great labor, you know, baby came out perfectly, and now we're waiting for the placenta, which should only take 15 to 20 minutes to come out. Okay. And it's not moving. Okay. Or it moved, it came out like it's supposed to, but there are fragments in there. Okay. Uh, the placenta, keep in mind, is connected to the inner lining of your endometrium. Okay. And if the placenta does not come out uh, all the way, or at least fragments in there, that's a big gaping hole that can increase her risk of bleeding. And if it doesn't do it naturally, the uterus is not gonna go through involution. It's just not. And then if there's fragments in there, uh, that increases the risk of the other one, which is infection. Okay. Now, although there are lots of things that can alter the involution of a uterus, uh, before I go on, I would like to mention that the placenta with the fragments in the endometrium in relation, I should have mentioned this earlier. The endometrium should have a new lining within 10 days. And I'll get into other information in regards to fundal changes in a minute. So within 10 days, the endometrium should have a new lining, and it's not going to have a new lining, and she's going to notice and have signs of infection, and she may be bleeding because this placenta did not come all the way through and there's fragments in there. And an infection, she may have a really bad fever that shows that there's something else going on that they might have to do. They might have to go in there, do a DNC, or do whatever other things that is required to get rid of those fragments of that placenta. Now, good things. Good things that increase involution. She had a good labor. Her labor process was A1. Okay. She had a good labor and birth. And nurses play a key role in that. Okay, with support and all the other stuff, with just great in pain management. Um, Another way that we can enhance involution is that we uh, can encourage breastfeeding. Why? Let's think about this for a minute. Breastfeeding releases a hormone called oxytocin. Okay, oxytocin makes your uterus contract, which is what you want, because you want the uterus to go back down to pre-pregnancy size. Uh, and it shouldn't be palpable after 10 days anyway. But breastfeeding is a really good thing. Now, I know that in future lectures or future videos, if I make any, we're going to talk about after pains, but breastfeeding can cause cramps. So what we want to give her is make sure she has ibuprofen on standby. Uh, but it is more so felt with moms who've had more than one child, may not necessarily be felt with a mom who has had one kid. I know I didn't feel any after pain. Yeah. Yep. Uh, and another way that we can enhance involution naturally is if your placenta does what it's supposed to do. It expels itself naturally. Okay? Why? We just mentioned that if the placenta does not expel naturally, it's going to cause a slew of problems. Okay. And another good thing that enhances involution that our moms are going to be mad at. I know for me personally, I was really angry with my nurse, but I liked her because she was nice to me. Um, is ambulation. Okay. Uh, but Jenny said, and this is smart to do, before you get them up, make sure they have sensation in their legs. Don't just be like, oh, you just had baby, time to get up. She probably came in for her toes. That's when you come in, you do your assessment. Because usually it'll tell you the peak and trough of medication where it wears off. You want to get her to walk around uh, and get her what used to be uh, just to get everything moving, and the sooner she gets up, especially after a C-section or epidural or a spinal block, that will help with this involution situation. Okay, so ambulation helps too. All right, so now let's talk about everyone's favorite topic: fundal position changes. Okay, immediately after delivery, it will be your between your pubis and your umbilicus. Okay, it's going to be slightly raised. Okay, When we do our fundo massages as nurses, we're going to hold the lower segment so it doesn't push down. And we're going to massage it, get it moving, get it contracting. Within 12 hours, it should be at your umbilicus. Okay, so she's probably going to be in hospital 2-3 days max, more than likely 2-3 days. It doesn't take that long. But the next shift, you should tell them, they should probably already know where the umbilicus should be. It should, I mean, where their fundus, goodness gracious, when their where their fundus or uterus should be, it should be at their umbilicus. Okay, it should move one finger breadth. Let me write this stuff down. Well, yeah, I'm writing it down. So start over. Don't freak out. So fundal position changes immediately at birth. Immediately following birth. Sorry. Just put birth here, and I'm gonna write between your symphysis pubis and umbilicus. 12 hours following birth, it should be at your umbilicus. Okay? Every day, UD, it should decrease 1 centimeter or 1 finger breadth. By day 10, it should not be palpable, as in when we do our assessment, our fundal assessment, we should not be feeling the mom's uterus. It should be a pelvic organ, excuse me, like it should be, and we shouldn't be able to feel it. Okay? It should be the size of a grapefruit, and you also want to let the mom know that 6 weeks postpartum, she should be back to the uterus, not her body weight. Uh, the uterus should be back to its pre-pregnancy state. Okay, and please, 10 days postpartum, it should not be palpable. Okay, all right. And that's it for the first half of postpartum lecture. Hope you guys liked it. Bye.